With us today, we have plastic surgeon Dr. Elizabeth Lee. She's back by popular demand, and this time we're talking about Latisse and your eyelashes. Later, we'll be taking your calls, answering any questions you might have about Latisse and anything that has to do with plastic surgery. The doctor is an expert on all that. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the doctor's office, so be ready to jot those down. And before we get started, any advice we give you today, you certainly want to consult your own physician as well. Welcome back to the program.
Thank you.
You know, we've covered a lot of body parts.
Yes, we have.
And from tip to toe. One thing we've never talked about, eyelashes. I mean, you know, you go to the drugstore,
aisles and aisles of eyelash products, absolutely.
I mean, Maybelline, large cosmetic company, made its claim to fame, eyelashes.
Right.
What's behind this lust for eyelashes?
You know, I'm not really sure, but there's nothing quite like them for feeling really glamorous.
I brought a special bag with me today. It's a goodie bag of all the crazy contraptions, the things. These are false eyelashes. Here we go. There's my camera. And this implement of torture.
Love that.
We do some mighty strange things to get long lashes.
Right. I think that lashes define the eyes. And I think that we can use makeup, but the eyes, you know, are the windows of the soul. And so now we have this great new product that actually makes the eyelashes grow.
Before you give away too much, we made a trip to your office, and we're going to run down some of the crazy, the crazy ways we can enhance it. We're going to tease that a little bit forward.
Good.
So tell me, this Latisse business, it's FDA approved.
Yes, and that really is the difference between the Latisse and the other eyelash growing products that are out there. The Latisse, and I brought a little bottle of it here, and it's dispensed with brushes here. Latisse is by Allergan, and it is actually FDA approved for use to grow eyelashes. And that's what makes it different from all the other products.
Okay, what is it, like Rogaine for the eyelashes?
You know, it's sort of along those lines. I mean, the medication that is in Latisse was developed for use to treat glaucoma, and one of the incidental findings was that the eyelashes grew when the patients were using it, instilling drops of the medication in their eyes. So we said, hey, this is great. We can do this. It doesn't need to go in the eye. It just gets painted on the eyelid at the lash margin, just like an eyeliner would.
Okay. The trip we took to your office, we're going to run down some of the crazy things that we do to enhance nature.
Right.
Let's get a look. Try putting these things on, and it's just, I can't, they're a nightmare.
False eyelashes, I understand, involve putting glue right near your eye.
They fall off in the champagne glass at the end of the evening.
That's really elegant looking.
Isn't it?
You know, when you have it hanging off the end of your eye.
Right,
And, you know, what is that?
What is that? Is that
right.
pet?
Then there's also the eyelash extension, when it was really glamorous for exactly 72 hours before they all started falling off my right eye. And so I was walking around with left and nothing on the right. And then now what do I do? Mascara works really well, but when you have fabulous base lashes, the mascara works even better.
Yeah. I want brooms. I want lashes that are like push brooms.
What I really, really, really am enjoying doing is the Latisse, the new FDA-approved product that is designed just for eyelash growth. It works on everybody. You see results in different amounts of time. So what we've seen is results in anywhere between 6 weeks to 3 months. There are warnings associated with it. It was developed for use, the medication that's in it was developed for use for glaucoma. And what has been found with use for glaucoma is that you can get some darkening of the iris or the pigmented part of your eye. This is dispensed like a prescription medication, and placing a drop on each brush, applying the brush to your eye like an eyeliner. So it's right along the lash margin. You're not putting it in your eye. What we've seen is results in anywhere between 6 weeks to 3 months. And it's a fabulous little thing.
All right, this fabulous little thing, what's in it? What makes it work?
This is a medication called Bitopromost, which is a prostaglandin medication, again, developed for use to treat glaucoma, okay, but as a side effect in the treatment of glaucoma, they got eyelash growth.
Okay, now I actually applied it. We're going to show some pictures of before and after just to measure it, because you know, I just want to test these things out to make sure that they're the real deal for our viewers. We got to take a quick break, but for more information about Dr. Elizabeth Lee, you can call her directly, 704, that's 510 area code 704-2170, or check her out on the web at artfulsurgery.com, and we'll be taking your phone calls and continue our talk about eyelashes when we come back on Body Beautiful.